is now being recorded, and there's a YouTube channel where we'll be posting the recordings for these meetings. So if you're not able to attend, or if you have other staff who would like to watch the recordings, those will be available. I'll have to send that link out later, possibly at the end of this meeting, but just know that they're being recorded and they will be accessible to you. Okay, so again, I've mentioned this a few times for Microsoft Teams. You can mute yourself, turn your camera on and off. We will be utilizing the chat function quite a bit. So again, at the top of the screen, there's a little message box, little icon. If you click on that, it'll pull up the chat box for you. So that's a really good place to put in your questions. So as I'm talking through all this material, if questions come up, drop them in the chat box and we'll keep note of those and we'll answer them throughout the meeting. And if we miss them, we'll come back to it at the end. But please utilize that function. It's a really good place to ask questions. I'm also going to be putting links pretty frequently in the chat box, so keep an eye on that as well. So a lot of the resources that I'm going to be sharing today, I'll drop the links in the chat box so that you all can have them. Okay, so who am I? Who is this voice that you're hearing? My name is Rebecca O'Brien. I work for the Pima County Health Department. I'm a program manager here. Typically in pre-COVID times, I work on tobacco and chronic disease issues. So now I'm working as a liaison for the schools and child care team. If a lot of you are affiliated with a school district, you likely know Brian Eller. He's the liaison for K through 12 schools, and he hosts weekly meetings just like this one. So if you do participate in Brian's weekly calls, just know that this meeting is going to be very similar to those. You might hear a lot of the same information. So again, just kind of know that. And is it only for administrators? No, it's not. So if you feel like it would be useful to have other staff on this call, you're more than welcome to share the invitation with them. This call is really just to help educate childcare providers about what's going on related to COVID. And you feel that we should get on each week? That's a good question. You might just sort of see how this goes today and feel like if this is useful for you to jump on. These meetings will be held every other week. So unlike Brian's K through 12 meetings, which are weekly, I'm going to hold these child care meetings every other week, so twice a month. So it might come to a point where we feel like we need to hold these more often or less often. We'll just kind of have to see how it goes. This is new for all of us. So we'll see. Let's jump right in. Actually, I'm going to jump back really quick. There are a couple other folks on the team who are going to help answer questions throughout these calls. You likely have worked with some of these folks in other capacities as well. Athena Archer is a public health nurse who's also working as a liaison for child care providers right now. If you've reported a positive case to us at the health department in the past, you've either spoken to me or you've spoken to Athena. She'll be on the call a little bit later. And then Diane, if a lot of you probably know Diane, she works with Childcare Centers already. Unlike Athena and I, who've not worked with you all in the past, many of you probably know Diane and are more familiar with her. So she's going to help answer a lot of questions and continue to work with you all as well. And then Brian, as I mentioned, is also on the call today. He works with many of you as well if you're affiliated with K through 12 schools. So is the hours counted as professional development? That's a good question. That probably depends on what you need professional development for. Brian answered there as well. We can investigate this as an option. Again, this webinar is really just an educational tool for all of you. We're going to try and be as transparent as possible, provide any resources that we have, and I really just want this to be an opportunity for you all to ask questions, and we can just be a sounding board for you and answer anything that you have going on. That's really what I hope will be. There we go. I'm going to jump right in. And some of this information is going to be really basic to start off with. Symptoms, for example. Likely, a lot of you are very familiar at this point with COVID symptoms, and I'm going to brush through a lot of this, but I just want to make sure that we're kind of all on the same page before we jump into some of the more kind of technical things, if you will. So, let me pull up the right screen. So this is just the CDC website. You should be seeing right now the list of symptoms to watch for related to COVID. So I just wanted, again, to bring this up because, as you can see, and many of you know, COVID symptoms are very much a lot of other things that we typically see this time of year. Your typical cold and flu symptoms, a lot of these are very similar. So, I know this makes it really tough in the childcare setting if a kiddo has just, a runny nose. We don't really know what it could be unless they get tested. And so that's why COVID is so tough, I know, for all of you. But again, I just wanted to bring up the symptoms just so you all can look at them again and just sort of be reminded that these are the things to look for when you all are symptom monitoring the kids or asking parents to monitor symptoms. These are the things we want to look for: fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Okay. Close contacts. So this is where we kind of really get into the fun stuff, which is what happens if someone has COVID and they're around other people? What do we do? Who do we determine to be a close contact? Well, this is a really good graphic to, too big, to show you what we mean as a close contact. And thanks to our friends at U of A, we have this lovely graphic to show you what that means. So someone who's a close contact, meaning they've been near someone who has COVID, these are the things that would qualify them as a close contact. Being within 6 feet of someone who has COVID for a cumulative of 15 minutes or more within a 24-hour period. And this is with or without a mask. So over a 24-hour period, was the infected individual near someone for at least 15 minutes and within 6 feet. So cumulative, meaning they could have spent 5 minutes within 6 feet of someone at 7 a.m. And then at 10 a.m., they were around that same person within 6 feet for another 5 minutes. And then at 3 p.m. that same day, they were around that individual again within 6 feet for another 5 minutes, totaling 15 minutes. That would then make that person a close contact. Some other things, if someone provides care at home for someone who's sick with COVID-19, that makes them a close contact. If they had direct physical contact, such as hugging or kissing, I know that this can be tough, again, when you're working with little kiddos who, often need comforting. A hug would typically be the route to go. If hugs are happening, that would make them a direct close contact of someone. Sharing drinking or eating utensils, they've sneezed, coughed, or somehow got respiratory droplets on you. So this is a big one. If someone sneezes on someone else and they have COVID, then whoever they sneezed on would then be a close contact. So here are the things to do, what to do if you've been in close contact. And we're going to go over this a lot more in detail. Not necessarily today because I want to make sure we get through everything else, but at our next meeting especially, we're going to spend a lot of time just troubleshooting. What do you do if you've been a close contact of someone, or what do you do if someone in your facility is a close contact? Because I know these are a lot of the questions that you all have is, well, what do we do now? This little graphic is just a basic overview. If someone is a close contact, they need to quarantine for 14 days after the last known exposure with that person. The reason we're going to go into this in more detail later is because there now are some shortened quarantine options for folks. But for the sake of simplicity, I'm going to say 14 days right now, just before we get into the nitty-gritty. Close contacts also need to stay home from work or school or childcare and maintain a 6-foot distance from others. Self-monitor for symptoms of COVID-19. Stay away from individuals with high risk for severe illness. So older folks, individuals who are immunocompromised, we definitely want to make sure that those individuals are not being in contact with others. So what I'm going to do right now is put the link for this in the chat box so you all have it. Oh, it's already in there. Brian, you're awesome. Thank you. Perfect. Okay. So again, we're going to continue to reiterate close contacts over and over and over, but the main thing to remember are these bullet points up at the top. Someone who's within 6 feet for more than 15 minutes within a 24-hour period, that's a biggie. Provided care, had direct physical contact, shared eating or drinking utensils, or have sneezed, coughed, or gotten respiratory droplets on them. Okay. So a little bit more into the what do we do situation. Brian, if you can put this link in the chat box as well. This is the guidance that we at the health department utilize when you guys are calling, asking us for help. Well, what do we do if someone got sick? What do we do if they've been in close contact? This release from isolation and quarantine guidance is sort of the holy grail, and it's what we use to help guide you all. So I want you to have this as well. It lays out essentially every scenario for if a person is symptomatic and they're waiting for their test results, if they're symptomatic and they've tested positive, they're symptomatic and they tested negative. You can see there's all these different scenarios. And then down at the bottom, well, what if they didn't have symptoms but they tested positive, or if they didn't have symptoms and they tested negative, etc. Excuse me. So again, I'm going to share this with all of you. If we have time at the end, I'll circle back to this and we can go into this in more detail. I just want to make sure we get through a couple other things before we go real heavy into the isolation and quarantine guidance. But a lot of you probably have questions about this. So just hang tight. And again, we'll get you the link to this so you can have a little bit more time to look at it as well. And if you're looking at it while I'm talking and have questions, drop them in the chat box and we'll get those answered. Okay, so a couple other things about quarantine and isolation. As I mentioned, there are other options now for a shortened quarantine. And quarantine is specifically for individuals who are a close contact. Isolation is for individuals who have tested positive for COVID. So individuals who have tested positive for COVID, you can see here in the middle of the screen, they need to isolate at home for 10 days since symptoms first appeared, and at least 24 hours have passed since last fever, and all of their other symptoms have improved. So that's isolation. Isolation is for those people who have tested positive. Quarantine is for individuals who are exposed to someone who has COVID. So again, those are the people who are a close contact. Those are the folks that need to quarantine. The safest sort of quarantine guidance we can offer is that if they were exposed to someone, they should quarantine at home for 14 days. 14 days is always going to be the safest option. But there are options for a shortened quarantine. And again, thanks to our lovely friends at U of A, we have this graphic that makes things far easier to understand than me just rattling information off to you. But these are the two acceptable alternatives to quarantine. And they only apply to individuals who do not have symptoms. So if someone is a known close contact, but they're symptom-free, they've been continuing to wear masks and socially distance, then they are qualified, if you will, for these other two quarantine options. The first one being that someone may end their quarantine after day 10 without testing if no symptoms have been reported. So if they've been asymptomatic, they decided they didn't want to get tested, that's fine. By day 10, they're good to go. So you can see here their last exposure to someone was on Thursday. The first day of quarantine begins on Friday. 10 days have gone by. They still don't have any symptoms. All is well. Day 11, they can return to school, or in this case to work, or to the child care facility if they're a child. The second option can end even earlier after day 7 if they don't have any symptoms and they have a negative test. So the test must be taken within 48 hours before the time of the planned shortened quarantine, and the quarantine cannot end any sooner than day 7. So if they were exposed on Thursday, their quarantine starts on Friday. They get their test on day 5, and then a couple of days later, their test is negative, and they can return on day 8. So these are the two shortened quarantine options. As I mentioned, in the childcare setting, we know that it can be hard to wear masks. For younger kids, we don't want them to wear masks anyways. Under the age of 2, kids should not be wearing masks under the age of 2. And so we know that some of the mitigation strategies that are more easily done in other locations are hard in the childcare setting, like wearing masks, like socially distancing, because the kids need to be closer typically. So that's why it can be hard to offer the shortened quarantine options in these kinds of scenarios, because we really want to make sure that those other mitigation strategies are in place before we suggest these options. So the 14-day quarantine is always going to be the safer bet, as I mentioned, but if folks do sort of fit within this criteria, we've got two other options. And Brian, I haven't checked the chat box, but if you've been able to drop this link in there as well, that would be awesome. I'm assuming you did, so thank you in advance. You guys can have this graphic as well. Okay, I am going to stop here and just look at the chat box to make sure I haven't missed anything crazy. Okay, volume issues. Is anyone else having issues with my volume, or can you all hear me okay? I can speak louder.
Rebecca, I think the anytime there's a volume issue for any of those on the call, just go ahead, log out and log back in. Sometimes Teams has some weird stuff like that. So if that doesn't resolve your volume issue, then just go ahead and post it in the chat and I'll work with you directly on that.
Okay, thanks, Brian. I appreciate that. So I'm going to pause here. That was a lot of information in 10 minutes. Does anybody have any questions right now about anything I just went over? And know that we're going to go over this over and over and over for many, many weeks. But does this cursory overview so far make sense to everybody? Can you repost those links, please? I cannot see them. Yes, Rachel, we will post these. Thank you, Brian. And if you do have a question, you can drop it in the chat box, or if you prefer, you could unmute yourself now and ask it out loud as well. I'll give everybody just another, info is perfect. Okay, I will take that as a sign to move on. Okay, so probably either the next meeting or the meeting after, we're going to spend the entire time just talking about mitigation strategies. But for now, I just want to go over some real basic ones that are specific to childcare settings. This is a resource that I will share with all of you as well towards the end of the meeting, but there are a lot of ways to help mitigate COVID in the childcare setting. Some we've already talked about: mask wearing for staff, particularly washing hands. These are all things that we're doing in our day-to-day lives anyways. But hand washing, super important, having the kids wash their hands as much as they can, having staff wash their hands as much as they can. And then there's a lot of other things that can go on in the childcare setting as well. Disinfecting, trying to limit the number of shared toys is a big one. So if there's certain toys that typically are shared among a group of kids all the time, it might be worth removing those items for now, as much as a bummer as that might be. This resource has things on everything from diapering to washing, feeding, or holding a child, transportation, having to minimize contact between staff and children via in some of the transportation settings. Some other things that have come up a lot in the past couple of weeks, and it really is a big help when it comes to limiting the spread in childcare settings, is cohorting, or keeping students and staff within a particular classroom. I know this can be hard in this setting, and that a lot of staff are often working in multiple rooms, or they're going from one room to the other. They need to help out another teacher. I know that this can be hard, but the more that we can keep groups of staff and kids in one room, the better off you're going to be if you do have someone who tested positive and is potentially exposed to other people. If they've been only in one classroom, then that greatly reduces the number of close contacts that you might have. If they've been bouncing around from room to room, or if the kids have bouncing around from room to room, then we're getting into a realm where you could potentially have a lot of close contacts. So the more that you can keep groups together and not be moving around, the better off you'll be. So that's just been a really useful mitigation strategy for a lot of folks. Also thinking about changing the way you do drop-off and pickup. Limiting the number of visitors that are allowed into the building, or not allowing them in at all. So parents can drop the kids off at the door, and then staff can escort them in. Another way to limit spread. So this is a really good resource. We'll share this one as well. So we'll spend a lot more time talking about mitigation strategies in more detail, but I just wanted to get you all thinking about some options that maybe you haven't thought about. So limiting visitors, signage and marking areas with 6 feet spacing. So if you have kids that are old enough to kind of do this if you've got maybe little stickers that you can put on the floor so that they can keep social distance, or putting signs outside to let parents know to distance themselves when they're picking kids up and dropping them off. There's a lot of sort of easy fixes, if you will, that you can implement. Physical social distancing. This also includes information on everything from toothbrushing to naps. If naps are going on in the facility, we make sure that the kids are napping head to toe, not having their faces next to each other is another thing to think about. We talked about hand washing, cleaning and disinfecting. So I don't want to go over all this today. We'll be here all day if we did, but just know there are a lot of mitigation strategies. I know a lot of you are doing them already. And so, kudos to you all. I know this has just been a really tough time, but we'll keep talking about all these other options for you so that we can offer up as many ideas as possible. If you haven't heard of the Swiss cheese model, it's essentially if you stack up a bunch of pieces of Swiss cheese, all the holes will eventually overlap, and then, you've essentially mitigated, in this analogy, COVID. So the more mitigation strategies we can layer on top of each other, the better off you'll be. So we'll keep talking about these mitigation strategies, so you guys can add more slices of Swiss cheese, if you will, to your repertoire. Okay, so I'm going to pause here again because we're going to change gears a little bit, and I'm going to talk about reporting positive cases to the health department. So I'm going to stop here and see if there are any questions. Can you send the link to what you're looking at now, please? Yes, I can. I'll do it right now. I just wanted to get through it first. It is right here. Okay.
Hey, Becca, before you, can you repost one more time and then just hit the space bar right after you post the link, and then it'll do a hyperlink.
I did hit the space bar. It didn't go, no?
I'll try working with it. Keep going.
Okay. Sorry about that. I'm not sure why that's not linking. Okay. So, reporting positive cases. The not so fun part if you are in a situation where you need to do this. But I'm going to show you first the emergency measure from Arizona Department of Health Services that essentially says this is something you need to do. But here in the middle of the page, it says that an administrator of a school or child care establishment and several other folks need to report to the local health department, which is us, the Pima County Health Department, if an outbreak occurs. And an outbreak in this situation is defined as 2 or more laboratory confirmed COVID-19 cases among students, children in care, staff, and these have to occur within a 14-day period. So if you have 2 positive cases within a 14-day period that are either a child that attends your facility or a staff person that works for you, then you do need to report those positive cases to us. The other piece here is that they need to be epidemiologically linked and do not share a household. So, for example, what that means is if the 2 positive cases you have are a brother and sister, they share a household. So that's not an outbreak. You do not need to report that to us. But if the 2 positive cases are a child in your toddler room, for example, and the other positive person is the teacher in the toddler room, and those 2 cases occurred within a 14-day period, then you do need to report that to us. The other piece of this is down here at the bottom, that you do need to inform parents and guardians if an outbreak occurs in your facility. So again, an outbreak is that two or more cases within a 14-day period. They don't share a household. So we do have a letter template that we can share with you if you end up having an outbreak and you need to share that information with parents. We have a letter template that we can share with you. I'm not going to drop that one in the chat box quite yet because we'll be in contact with you very closely if an outbreak does occur, and I'll just send it to you via email at that time. So again, if you have 2 or more positive cases within a 14-day period who are epidemiologically linked, that does need to be reported to us at the health department, and I'm going to show you now exactly how you can go about doing that. Let me stop sharing this, and I'm going to share a PDF. Okay, so this is how the process goes. If you find yourself in a scenario where you have those 2 or more positive cases within a 14-day period, the way that you get in contact with us is, there's a couple different ways. One, you can just email me directly, and when we're done here, I'll put my contact information up. Also, it's at the bottom of the emails that I've been sending you about this meeting. You can call or email me directly anytime, and I can get the information from you. That's option number 1. Option number 2 is you can call our EPI line, which is 724-7797. You can call that number, and they'll either take the information from you, or if no one is able to answer the phone at that time, you can leave a voicemail and say, "Hi, this is so-and-so from this child care facility. We have 2 or more positive cases that I would like to report." That's really all you need to say on the voicemail. It'll get forwarded to me, and then I'll call you right back. And then the third option is that you can report your case online, which I'll show you here shortly, but I'm just going to walk through this process again one more time. If an outbreak occurs, or if you just need technical assistance, you just have a question that you want some information on, you can, again, call this 724-7797 number, explain your question, or leave a voicemail explaining your question or the outbreak that you need to report, or you can email or call me directly, and we will collect the information on the positive cases from you via the phone. Once we've collected that information, case investigation and contact tracing will be conducted. That's not something that I will do. We have a kind of a third party who does the contact tracing for us. So just know that that will happen at some point after we collect this information from you. So that's really the process. You give us a call, 724-7797, or you call me, or you report the case on our website, and we'll call you back and collect the information about the positive case. If you're leaving a voicemail about reporting the case, you don't need to provide information about the positive cases in the voicemail. You know, we don't want to collect that information at that point. Just leave a voicemail saying, "I have positive cases to report." So this is the process. I'm going to show you now how you can report online. I do think that's probably the easiest way to go. So let me stop sharing this briefly. We're going to go back over here. Okay. So the easiest way to get there first is just to go to pima.gov. This is the regular Pima County website. If you go to pima.gov, over here on the right, there's Back to School and Childcare. There's a link here. If you click that, this will take you to our Back to School and Childcare webpage. I highly recommend bookmarking this page. If you've not been to this page before, we have a number of resources here, and it's easiest if you just bookmark it. If for some reason you can't remember how to get there, just always go to pima.gov, and on the right-hand side, there's going to always be a link there for Back to School and Childcare. If you have worked with Brian in the past, or you're affiliated with a K-12 school as well, just be mindful that we have 2 big blue buttons here for reporting a case. If you're reporting a case for K-12, you use the Schools Report a Case button. If you are reporting for childcare, so any kiddos under, who are not in kindergarten and under, 5 and under, use the Child Care Providers Report a Case button. So again, if you have those 2 or more positive cases within a 14-day period and you want to report them to us because you need to, click this big blue button here. And this will take you to a form where this information we only want on the person who's reporting the case to us. So if you're the director of a facility or the owner of a facility, or you're just a staff member, we want your information here. So for example, me, you put in your email, phone number, Again, this is your phone number, not the phone number or email of the positive cases, the facility name, ABC Learning. And then in the message box, all we want to know here is the number of positive cases. That's it. So if you have 3 positive cases, you could just literally put the number 3, or you can write 3 positive cases. In the message box, we do not want you to put any identifiable information here. So we don't want to know the positive case individual. We don't want to know their name. We don't want to know their date of birth. We don't want to know any of that yet. We just need to know how many cases you have. And then you just type in the security measure and hit submit. That's all you have to do if you want to report online. A notification will come to myself and Athena notifying us that someone has submitted this form saying that they have positive cases to report. And Athena and I will call you right back as soon as we get this notification. So it's super important that you put in a phone number that you utilize regularly, a cell phone or an office number that you're going to be able to answer, because we'll call you back. When we call you, that's when we're going to gather some additional information on the individuals who tested positive. So that's going to be their first and last name, their date of birth. We're also going to want to know if they had any symptoms, when those symptoms occurred. So the first day that those symptoms came on. We'll also want to know their last day at the facility. So for example, if they felt like they were getting sick on January 1st, so they came to work, let's say it was a staff person on January 1st, and they were complaining of a headache and a sore throat on the 1st, that would be symptom onset day. That's a day we would want to know. We also want to know the last day they were at work, so if they went home sick on the 1st, we want to know what day they went home. Some other information we're going to ask you for is what classroom they were in. So if it was a teacher or a child, if they were in a particular classroom, or if they were in a toddler room or the 1s and 2s room, that's information we'll want to know. That'll help us determine if you really are having an outbreak or if you just happen to have 2 cases that occurred within 14 days. It'll help us determine if the infection spread was happening in your facility or elsewhere. So that's why we'll want to know what room they've been in. So that's the information we're going to ask from you via the phone. Again, don't provide that information in this form. We'll call you right back and we'll take that information over the phone. So that's how you report a case to us. It's super simple. Again, you can call that 724-7797 number. And if someone answers the phone, they can take that information over the phone from you, or your contact information will get sent to Athena and I, and we'll give you a call right back. So you can call that number, you can call me, or you can report your case online via our Back to School and Child Care Provider webpage, which looks like this. You just click the big blue button. So again, I will stop here and see what has been going on in the chat box. So do we need to notify parents for just one case when it's not an outbreak? So according to Emergency Measure 2020-03 that I pulled up, you do not. You can make that decision about whether you want to inform if you've just had one positive case. So as Rachel mentioned, yeah, transparency helps to build trust. I've often recommended to folks in the past that I do think it's important to just sort of share that information with the parents. Again, we do have a template letter that we can share that just sort of says, hey, your child has potentially been exposed, or they have in fact been exposed. So you don't have to. That can be your call. Yes, I will send the PDF out to everyone after the call with that guidance. Arizona has the highest rate of COVID in the world. Does Pima County Health anticipate making recommendations for closures? Brian, do you want to help me with that one?
Sure, I can. Give me 2 seconds. Hold on.
Okay.
Kristen, I got to jump on another call. I'll be on in a second. Sorry, I'm monitoring 2 things at the same time here. Yeah, we are looking at the latest rates of data from schools in terms of submissions for COVID positive cases. And we're not sure right now. We can't make a solid recommendation. The data that we see is conflicting in terms of the sense that 5 to 10, the actual positive cases in 5 to 10 years of age, are significantly less than that of 11 to 18. In that same thread, we don't know if it's because of asymptomatic presentation. There's research that suggests that 5 to 10-year-olds are more likely to be asymptomatic, and when they are symptomatic, they have up to 4 times the viral load. So we do know that symptomatic individuals spread more frequently. The big message for all of you on this call today is mitigation, mitigation, mitigation. The Arizona mask law is for now 2 years and older. So that's an additional tool that you can put in your toolbox to assist with mitigation techniques. I know that Rebecca is going to have some more information on that on this and further upcoming webinars. But that's what we can give you for right now in terms of a recommendation for going remote or hybrid. We are leaning a little bit more towards a remote learning model. And we're also considering a staggered return where elementary and early childhood would be eligible to come back earlier because of those decreased rates of transmission within those age populations.
Thanks, Brian. John, let me see. If you're able to clarify, are you saying the guidance that like Athena and I are giving versus guidance parents are getting possibly from contact tracers that are calling about close contacts? That may be correct. Okay. Again, Brian, I know we've had this come up a couple of times in the past, I believe, where there seems to be kind of different guidance from what our school and child care liaison team is offering versus what the community is hearing from contact tracers.
Yeah. So what I can say on that end is ultimately follow the direction of the contact tracers, case investigators. They'll have the final say. Know that this shift to 10-day reduced quarantine is fairly recent. COVID moves fast and furious. So the contact tracers, case investigators will have the final say. We do have the policies and practices in place for those individuals that are making the calls out to cases and to close contacts to give the updated guidance, but it's going to take some time before all 150 of that subcontract team from Maximus is able to provide that updated guidance. So it's a lot of really big moving cogs, big moving wheels, and small ones too.
Thank you. We will be talking about vaccines today. Just as soon as I get through these last couple of questions, that's what we're going to jump into. If we have a low number of students, about 8, should we report 1 case? So here's the other thing I'll say. You guys are more than welcome to report just a singular case to us at the health department. Again, you're not required to. You're only required to report an outbreak, which is 2 or more positive cases within a 14-day period. We've had lots of facilities just report 1 case to us, and that's totally fine. We will take that information from you, and it's a really good opportunity for us to help answer any questions that you might have. So if this is the first case, for example, that you've ever had and you're wondering what to do now, give us a call. We'll take that information, and it's a really good opportunity, again, for us to provide you with resources, answer any questions. We can send you different guidance that we have. We can send you that letter template, for example. It's just kind of a good touch point. So please feel free to call us at any point, whether you have questions in no positive cases, or you have questions in just 1 positive case, or you have questions in 20 positive cases. We're more than happy to answer any questions that you might have. So you don't have to report 1 positive case, but please feel free to do so, or just you can kind of talk through what you're thinking with us, and we can help work through some things. We're a resource for you, so just know that. Blah, blah, blah. Yes, Rachel, that's correct. You do not have to tell Pima County or the state if you only have the 1 case. It's 2 or more within a 14-day period. If in a 14-day period 2 cases are from the same family, report or not. Not. So if it's a brother and sister, for example, they're within the same household, you do not need to report that because that wouldn't be considered an outbreak in that case. Okay, so vaccines, which I think is probably what a lot of people are on here for, wanting to know what is going on with vaccines. So I might see if Brian can jump in at any point too, but essentially where we're at right now is the 1A group is still getting vaccinated, which is our direct healthcare providers. We're still in the 1A phase. The 1B phase is where school and childcare staff are able to get vaccinated. I don't have an exact date. I can't say for certain when we'll be getting to the 1B phase. I do expect that it will be soonish, but I don't know at this point. So for anyone who's in the 1B group, which likely is all of you on the phone, there isn't anything you need to do right now. I know that's been a question too, is what do we do? Do we need to start registering for things? And Brian, correct me if I'm wrong, but that I believe is still no. You don't need to do anything at this point. And we'll continue to update you on all of these calls, specifically about vaccines, where we're at on the time frame, what you need to do. But for the time being, you don't need to do anything except sit and wait. Brian, do you want to jump on that? Anything else?
Yeah, that's exactly right. So Rebecca will be the primary mechanism for communicating to you all when you should start registering your childcare providers. That will most likely, the best way for us to communicate that will be on this ongoing call. Although I know Rebecca's got a distribution list for all of you as well, and we'll send it out to you all via a link on that mechanism.
Yep. So what you'll be hearing from me again, it might be tomorrow. I just had to finish up a couple things. I'm going to be sending out another mass email to all of you because as we prepare for 1B, we need to know essentially how many childcare staff are in Pima County. That way we can provide that to our logistics team to help give them an idea of how many vaccinations might be needed for childcare providers in the 1B group. So you will be getting another email from me with a very short survey that's just going to ask you for the facility and the number of staff that work there. That's for a childcare center or in-home childcare center, and I only need this information one time for the one facility. So if you have multiple staff that work for you, I don't want them all to fill out the survey. I just want one person to fill out the survey for the one facility, and I just need to know how many staff work there. So you will be getting an email from me, again, likely tomorrow, that has some more instructions on that. Please note that this email does not register you for anything. This is not you signing up to get the vaccine. This is just us trying to gather some preliminary information on blanket across Pima County, roughly, how many people are child care providers in Pima County. That way we have an idea. And if you're thinking, well, I don't know if I'm going to get the vaccine, I don't know if I should count myself, please just provide us with the number of staff that work at your facility. If you're an in-home provider and it's just you just need to put one and send it back to us. Again, if you're not sure if you're going to get the vaccine, that's okay. Just please tell us how many people work at your facility, and that will help us greatly. And we'll be able to get 1B going out faster and smoother with that information. So just keep an eye out for that. And that's essentially where we're at with vaccines. I apologize, it's not, we don't have a lot more information at this point. Just know that 1B is coming, and I'll be communicating with you really frequently and giving you all the information I have so that when you are able to get vaccinated, we're ready to go with 1B, that you guys have all the information you need to go and get it done. So just hang tight on vaccines, and I'll update you every single meeting we have here.
Hey, Rebecca, just a couple things in the chat that I can address really quick.
Yep.
If you've already registered on the state system for vaccine, just make sure, please, that you don't put your site as a site of suspension, because there are very specific things that you need to do in terms of temperature controlled climates in order to receive those vaccinations. We will try to work with ADHS to make sure we get all that information. When we see a site that's registered, we'll try to redirect, but there's chances for hiccups there. So if you can hold off on the state site registration, that would be ideal. If you've already done it, no worries. Pima County will have a registration link for all of you to register to receive those vaccinations when 1B is available. So please do so. There is a mask question in there as well. It's the state mandates it on emergency measure 2020-03. If the county gets a complaint and we see that it's 2 to 5, we'll probably just call you and say, hey, you should probably just be
Mhm.
wearing masks, and that'll be the extent. Your staff definitely must wear masks. That is, there's no qualms about that piece. And I think that's, there's a couple other questions in there, Becca, but that should address the vaccine period.
Thank you, thank you. Let me just, I'm scrolling back here a minute just to make sure we didn't miss anything. Okay, I think we're all good here. Okay. So, for the last 10 minutes here, I can't believe this is actually on time, small miracle. I just want to share a couple other resources. I'm just going to drop these links in the chat box as well. So, this is Arizona Department of Health Services, and these are their dashboard metrics. So I've already clicked, on Pima County, and I'm going to send the link for this as well. But if you're just wanting to know what's going on in Pima County as far as cases per 100,000 individuals, what does that mean for the number of people who are positive via a percentage, if you want to know hospital visits for COVID-like illnesses in the region, this is where all this information is. So I'm going to just put this in here. This is just an FYI, a resource for you. The other one, I'm just going to also give you the link to our Back to Schools page. I showed you how to get there. You just go to pima.gov, and on the right-hand side, there's a link for the Back to School web page. I'm also going to just give you the link in the chat box. That way you can access it. And again, I do highly recommend that you bookmark that page. I didn't spend a lot of time on here yet, but there is some other information. Specific to childcare, there's an alert letter that I talked about. There's one here. There's a checklist. So if this is more geared towards parents, if they're looking for.
Hey, Becca. Sorry,
Yeah,
I got to interrupt. Kelly, please do not share that link out with anyone, please. That is for 1A only. Those are medical professionals. Your son's speech therapist is a registered and licensed medical professional. That is for 1A only. Do not share that out. Don't register, don't use it. We will have a link for 1B, but just please, because that will cause some serious issues for vaccine distribution and keeping us on track with 1B. I'm sorry to call you out like that, but we absolutely have to make sure that does not get shared. Thank you.
Yeah, I'm going to unmute myself because I didn't share a link. So I hear what you're saying, Brian. I was on the phone with her today, and she did say that she is 1B, and they have started to open the portal for 1B. That's the only reason why I said it. So there's no link that I put in to share. I wouldn't
Okay,
do that.
thank you.
All I'm
I
saying
really
is
appreciate it.
1B
Thank you.
portal did open today, I was told. But I maybe
will.
I'm completely wrong. So
Yeah, I doubt it because I was on the call this morning with all
okay.
of our internal team on that. But I mean, if you're right, then that's awesome. But I really doubt that is the case.
Okay.
I'm sorry for doing that, but like this is a serious panic button for me right now when I started seeing
Yeah,
that.
I
So
didn't share any
thank you.
links. So all I was saying is that's what I heard from my speech therapist, and she confirmed with me she was 1B. So I was, she works in the public schools, so I was a little taken back by that because, again, I didn't know 1B was open. So that's why I just put it in there. There's no link. If you look at everything I've put in the threads, there's no link for me.
Yeah, I know. There was other people that were asking for a thread. I just wanted to jump on it ASAP and just make sure that. So
Okay.
I apologize for that. It just we got to control that message. So thank you, and
Yeah.
I appreciate all you're doing.
No problem.
All right. Thank you, guys. I appreciate that. Okay. So again, this is our Back to Schools webpage. If you've not found it before and this is all new to you, take some time to look through it. We do have a lot of good information on here. Also linked from this page are the Pima County testing centers. I highly, highly recommend if you do have a situation come up in your facility where someone is symptomatic, staff or student, getting tested really is the only way you're going to know if they actually have COVID or not. And we have a lot of places in town throughout Pima County where someone can get tested for free. So again, how I got here was on our Back to Schools webpage. Click Pima County Testing Centers, and there's a lot of options here. So if you're on pretty much any side of town, there's an option for you. Keno Event Center you just click this big blue button and you can schedule your test online. Just pay attention on these locations. Some have, for example, this one doesn't do any walk-in tests. We have some options where you can walk up with no appointment. So just kind of pay attention when you're trying to figure out where you might want to send someone to go to get tested. There's also a phone number to call, Udall Center, Elletown, if you're kind of up more on the north side of town, El Pueblo Center testing. And we do have some pop-up testing centers. Again, so these ones you don't need to register for. You can just show up, walk up, and get tested. So if someone is looking for a test where they don't want to register or deal with our website or whatever, you can look this information up for them. So just keep that in mind. Lots of free testing going around, and we highly recommend that folks get tested if they are symptomatic. We've got just a couple more minutes here. The other thing that I wanted to mention is there is a free helpline. This is through Maricopa County, but it's for the state of Arizona for any child care centers or home-based providers that are currently open. They can call this helpline Monday to Friday, 8:30 to 4:30 if they have questions about COVID. So again, we're here for you at the health department anytime as well. But just know that there is another resource here available. You can call this number, 602-506-6767, and there's also an email. So this is just another resource for you guys. If for some reason that you prefer not to reach out to us at the health department, there is a statewide resource that is available to you. So I'll leave this up here on the screen for a minute. You all can take this information down, and I'm also going to drop the link in the chat box so you have it. Okay, so I've got 4 minutes left, and I've gone through just an absolute ton of information, I know, and I hope I didn't overwhelm you too much, but just know at our next meeting, which is not next Wednesday, but the following Wednesday, every other Wednesday on the 20th, I'm going to go over a lot of this information again. We're going to spend a lot more time talking about mitigation strategies, and I'll review how to report a case and all of that again. So please put any additional questions you have in the chat box now. Also feel free to unmute yourself and ask them. We'll stay on and answer any questions here at the end. I really, really appreciate you all joining us for this first meeting. Apologies if you're thinking this is something we should have done ages ago. Just know that a lot of us at the health department have been doing double duty for a long time, and apologies that we might be a little behind on this one. So we're happy to be here now. We're a resource for you anytime you need it. We're incredibly grateful for the work that you do keeping all of our kids safe here in Pima County. So thank you for your hard work, and we'll continue to do these meetings every other Wednesday or sooner if need be. So I'll take any questions at this point. Oh, my contact information, yes, thank you. I'm gonna do, give me 1 second, I'm gonna put it on the screen. Okay, you should all be seeing the agenda again, and I've got my contact information right here. I'm going to make it real big. This is me. Oops. That's my desk line, 724-7897. That also rings to my work cell phone, so if you call that number, you'll get a hold of me either way. And my email, rebecca.o'brien@pima.gov. If for some reason your email does not allow you to put in the apostrophe, if you take out the apostrophe, it'll still get to me. So that's been an adventure. What's the age group for the vaccine? Will it be available to kids? Down the road, we think yes. At the moment, though, Brian, it is 18 and over, no?
Yeah, that's correct. There is no vaccine for children under the age of 18, or it's 18 or 16 right now, and it's going to be a while before that is going to be available.
Yeah, So no vaccine for kids at this point. So again, it might be quite a bit of time before that happens, but 18 and over right now. When should we expect an announcement about current county recommendations for learning mode? 18 for Moderna, 16 for Pfizer. Thank you, Diane. Brian, do you have a question for or an answer for Carol?
As soon as we can. I've been working with Public Health Institute and CDC on running some analysis on data that I just got on Tuesday, so that we will make a decision based off of that. It does have to come from the top down. I sent off a lot of the information to admin this morning on a preliminary analysis. There's some other work that we have to do around before we actually make a decision on that. So we will we'll notify you as soon as it happens. I'm sure Becca can send an email out, and I'll be sending out a email as well.
Yeah. Okay. Could you clarify the mask mandate? Let me pull up.
Yeah, so Rachel, if you scroll down to page 2, the very bottom of page 2, and then page 3, it says under section 1C, masks should not be worn by children under the age of 2 or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The legal precedence for all of this masking, which falls under section 1 there, is set under ARS 36787, which is primary jurisdiction to AHS for authorization and execution of public health emergency mitigation responses. And the best thing I would recommend to do is to run this by any attorneys you know, and then to have them kind of consult you on how you want to implement it.
Okay, I know we're just a couple minutes over, so if you need to jump off, please feel free. I'll stick around for a couple more minutes here for any other additional questions, but I'm going to go ahead and stop the recording now. And again, I really appreciate you all. Thanks for joining today, and we'll see you on the 20th.